Hi. We hope you and your beloved family are in good health. Welcome back to our channel. Don't forget to subscribe to our channel. Please share and like our videos as well. We will keep sharing the valuable information in this channel. Keep supporting us. Let us start our new topic for today. Please keep watching and share this video. Thank you. How do I know if I have genital herpes? Despite the fact that millions of Americans are living with genital herpes, the disease can be surprisingly difficult to detect in some cases. However, many people with genital herpes have at least some detectable signs. The most obvious sign of genital herpes is the appearance of red bumps in and or around the genital area, often starting around 2 weeks after the initial exposure to herpes. The bumps may spread to the anus and or surrounding skin, and in some cases also develop within the vagina and or urinary tract. These bumps turn into blisters, which in turn become sores. Often these sores become encrusted and very itchy. After a period of time, however, they will clear up. An outbreak can involve a large number of sores, but can just as easily involve just a single one. Because genital herpes is incurable, these outbreaks will recur over time. Certain medications are available to increase the length of time in between herpes outbreaks. Other symptoms of genital herpes may or may not accompany an outbreak. These include a reddening and or sudden extreme dryness of the genital area, a burning, itching, and or painful sensation in the genital area, vaginal discharge, difficulty urinating, headache, fever, and or swollen glands. The most difficult aspect of genital herpes, and a large contributor to its spread, is that the herpes virus can remain inactive in many individuals and never cause them to show any signs or symptoms of the condition. However, they are still able to spread genital herpes to others. Many times the symptoms of genital herpes are confused with other conditions, such as yeast infections, urinary tract infections, and even ingrown hairs. While it's important to know and be able to recognize the symptoms of genital herpes, you should always seek an official diagnosis from a medical professional if you are at all concerned that you may have contracted the disease. Only they will be able to say for certain whether your symptoms are the result of herpes. If you do have genital herpes, they can provide you with medication and important information necessary to handle the condition. If you are currently experiencing an outbreak of genital herpes, a doctor can diagnose your condition visually. A blood test or a viral culture can also check for the herpes simplex virus, although results can be vague and or inaccurate in many cases. 2 different strains of the herpes simplex virus lead to genital herpes, HSV1 and HSV2. The former, HSV1, can indicate any form of herpes, including mouth sores, and does not necessarily translate into a genital herpes diagnosis. However, HSV2 is almost always linked to genital herpes, and is a more reliable sign of the disease. But a good practice would be to discuss alternative treatments with your physician. You may also want to consider complementary medicine, which is utilizing alternative treatments along with standard medicine. For example, I take prescription medicine daily for prevention and also go to a doctor for consultation, because these therapies complement each other. If you just had your first outbreak, then there could be many different roads that you will travel. For many, they have one outbreak, the initial one, and then they never have another herpes outbreak. For some, it can be more persistent and troublesome. There are products on the market today that can really help with outbreaks. However, in our opinion, the natural-based or herbal-based treatments are more effective at eliminating the outbreaks. Does this mean that they cure herpes? Cure is a strong word, but for many that use natural-based herpes treatments, they never have an outbreak again. Whether that is controlling the outbreaks or killing the viruses, we don't know, but for many they never have another outbreak, and that is vital. You can refer to video description below to get more details about 20 home remedies, natural recipes, with treatment guidelines. There are also Ayurveda solution, natural recipes, with treatment guidelines. Additional valuable information about essential oils solution with treatment guidelines, and also self-healing solution with treatment guidelines. If you want to learn more about how Dr. Christine Buehler discovered the way to eliminate herpes simplex virus in less than a month, you can watch her video. The link to her video at this video's description below.